Blood Purification Therapy, Lesson 7, Vascular Access 1. This unit covers the basics of blood purification therapy. The goal for this lesson is to learn about vascular access and understand arteriovenous fistula, AVF. This is the content of this lesson. The vascular access is a port that enables blood circulation between the patient and the dialyzer by placing a flexible and sterile thin plastic tube, or catheter line, into the patient's blood vessel. There are different types of vascular access. Hemodialysis requires access to a high flow rate of blood for fast and efficient treatment. Therefore, by creating a vascular access, VA, a high flow of blood can be continuously extracted and hemodialysis can be repeated. There are two categories of vascular access, VA with a shunt or without a shunt. Vascular access that requires an internal shunt is classified into two types, arteriovenous fistula, AVF, and arteriovenous graft. Average vascular access without a shunt is classified into central venous catheter placement, CVC, and brachial artery superficialization. In this lesson, AVF is explained. AVF refers to autologous endovascular shunt, and is created by anastomosing the artery and vein as shown in the figure in order to extract a high flow of blood. It is generally created on the forearm of the non-dominant arm. The radial artery and radial cutaneous vein are the most commonly used vessels for AVF. AVF is used by 90% of dialysis patients in Japan. One of the advantages of AVF is that the patency rate is higher compared to that of other VAs. In addition, the frequency of shunt infection is lower than other VAs, making AVF the first choice for vascular access. On the other hand, the disadvantage of AVF is that it cannot be used for about 2 weeks after being created. Also, repeated punctures at the same site may cause shunt stenosis due to intimal thickening or pseudoaneurysm. This is the end of Lesson 7, Vascular Access 1. Make sure you've mastered the basic concepts before you move on to the next level.